Hello and Assalamu alaikum. Ultrascan Diagnostics. So this is the CBCT of the patient that you had requested. The area of interest is the anterior bridge on the upper maxilla and the BTR in the lower left quadrant. So on the upper maxilla here, you can very clearly see we've got a bridge with BTRs present and faulty root canal treatment. So a doctor has asked if there is implant possibility for an implant placement. This is the upper right lateral incisor. Unfortunately, you can see that the buccal cortical plate here is very thin. The endodontic treatment is very faulty with poor posts present. So the ridge width is approximately 7 millimeters with 14 millimeters of height. So we've got an area for engagement in the apical region, but if this is extracted atraumatically and then grafted, so this area can definitely receive an implant in the future. This is the region of the central incisor. The central incisor again has no endodontic treatment, severe periapical radiolucency, very thin cortical buccal cortical plate, 6 millimeters of width with approximately 15 millimeters of height. Again, extraction and graft is the ideal scenario for the upper right, central and lateral. Upper left, central incisor, endodontic treatment, again, not very amazing, but at the same time, no radiolucencies can be observed. Very thin cortical plate present here. This tooth can be reposted for a post and core and a better crown. You got 7 millimeters of ridge width with 15 millimeters of height and very good quality bone underneath. The upper left lateral incisor again has poor endodontic treatment done. We've got a periapical radiolucency. We've got 7 millimeters of ridge width with 15 millimeters of height. So if this tooth is also extracted and grafted, future implant placement can definitely be possible. Moving to the upper right canine. The upper right canine also has a post but no crown here. No radiolucencies can be seen, and re-endodontic procedure can be done for a better tooth support. You've got 8 millimeters of ridge width with approximately 14 millimeters of ridge height in the upper right canine. Moving to the lower left premolar. The second premolar here is a BTR, where you can very clearly see this BTR is very close to the buccal cortical plate. We've got approximately 7 millimeters of ridge width with only 11 millimeters of height. So extraction and graft should be done, and then later on an implant procedure. Immediate implant placement here seems unlikely. We've got a lesion on the distal surface of the sixth. The lesion on the distal surface of the sixth is going to be more visible on the left hand side in the axial view, as you can very clearly see here. This lesion is what we're talking about. So this lesion here is definitely very close to the pulp, but it can be restored without endodontic procedure. Only a simple class 2 can protect this tooth from endodontic treatment. We've got lesions on the cervical areas of the right hand side lower teeth, as you can see here, right here, and then as you go further down you'll see some right here and some here as well. So there are class 5 lesions, something that the doctor needs to be aware and can restore without before they become endodontic procedures. Thank you very much.